As we know, in January, there was a surge in COVID cases and outbreaks, certainly in San Joaquin County, but throughout the country. And so we were approached in January by public health with the idea that the San Joaquin County Office of Education would take on the vaccination of all school employees, public and private, in San Joaquin County. And we jumped at that opportunity.
Our process from the time that people checked in at the tent to the point where they began their mandatory 15-minute observation period was on average 7 to 8 minutes. So between parking, coming through the process of checking in, screening, and getting vaccinated, and then the 15-minute mandatory waiting period, most people were able to get through the clinic in 30 minutes.
I don't know how we would have done it without CodeStack, because they were able to write these programs where all the different LEAs were able to submit information. And then once the database was there, it just really made the system doable, because now everything could be through email, text, QR code to the individuals that were in the database. So it took all the logistics off of districts, off of private schools, off of charter schools. So it would have been very complicated if we didn't have CodeStack doing that software piece to it. Just changed how we could do this clinic.
Everybody who came out of the clinic walking out had nothing but praises about the flow and the efficiencies. And obviously it's a big team effort from the county office, but in everything that we do today, technology plays a role. And this is just another example of how technology can make things more efficient.
Because of the scale, we had so many things to think about, and it was wonderful to work with all of the different departments, CodeStack, IT, operations, and the districts were able to provide also their trained healthcare aides. We also had amazing doctors from the community and other nurses from the community offer to come in and help. We had some nursing school students come and help. So it was wonderful to see so many people hearing about the vaccine clinic and wanting to come and be a part of it.
So you think about the people power and the minds that went into developing this, and just the heart they have to serve the community. So it says a lot about our people and the love our people have for the community and for serving others. Also says a lot about our leadership from Superintendent Musolimas all the way down, that yes, we're in, and we know there's going to be some hiccups and some questions that'll come up once we get in, but let's go for it, and let's do it because this is what the community needs. This is what our students need, staff need, business community, everybody needed this, because this is more than just the education pocket. This scope reaches our whole San Joaquin community.
I knew when we started this process that we were going to be doing something monumental, historical, and extraordinary. From the very first moment when the doors opened and we started taking people through the clinic, it was clear that we were changing lives. It was really one of the proudest moments in my educational career to see people so excited about getting vaccinated. People who have not seen their loved ones in over a year. Teachers who had not seen their colleagues, who were wanting to get back to normalcy with their own family and be a part of their community again. And those people stopped and thanked us repeatedly throughout the process. It was just such an overwhelming feeling.
I think most teachers want the schools to open sooner to be able to really get the kids back, get them, we're doing all we can to get them quality education, but nothing can replace the classroom.
Not having children in school is a public health crisis. And we are very fortunate to have Dr. Park and our public health department here in San Joaquin County that acknowledged that and wanted to do everything that they could do to support us in efforts to get children back into the classroom.
I am very proud to know that we contributed 25,822 doses. And that really speaks to the nature of SJCOE, to the innovation of SJCOE, to the customer service of SJCOE. I will always smile knowing what we accomplished as a team and knowing that we helped change the face of the pandemic.